aspect, offering our programs to online audiences, is one of the positives to emerge from 2 years of responding and adapting to the COVID-19 pandemic. So while we certainly would have preferred to continue in person over the last 2 years, we discovered the degree to which live streaming our speaking events and then archiving and making the videos available to you on our YouTube channel extended the reach of our programs. Long-term, our audiences have increased 5, 10, 20-fold and more. And so, as we return to in-person, we will continue to live stream as many of our events as possible, and we'll record and archive all of them. So we invite you, both here and at home, to check out our YouTube channel. That's YouTube/KC Library, to see the breadth of our signature programming. We've offered 121 online events in the past 2 years, and I can almost assure you that you'll want to catch up on some of those that you might have missed. I want to take a moment to thank our library staff across our entire system for all of their efforts and their ingenuity these past 2 years, working to bring services to our community despite the enormous challenges of the pandemic. In every single department, we have strived to serve members of our community where they are. We've also gone to parks and community centers, we've used our mobile services vehicles, and we've had the help of hundreds of community partners. I'd like to give a special shout out to our public affairs staff and the library's digital branch. They've worked tirelessly all hours of the day and night for the past 2 years to keep the library connected to the community and to inform and support all of you here in our community as well. So tonight kicks off what we think is an exceptional lineup of programming for this month, but we're also super excited about what we have coming up in April, including the launch of our first Big Read initiative since 2017. It's revolving around the U.S. Poet Laureate Joy Harjo and her book, An American Sunrise. She is the first Native American to serve as Poet Laureate, and the Big Read will be a 2-month celebration of not only reading and poetry, but also Native American literature and culture. Joy Harjo will speak and read from her works right here in Truman Forum on April 14th, so we hope you'll mark your calendars for that. For a full look at all of our programming for this month, next month, and beyond, go to our website, library.org, and click on events, and you can see the full lineup. So tonight, we have a panel of distinguished guests and a timely discussion of a matter of paramount concern over these past 2 years: the health and the welfare of our community amid the challenges of the pandemic. We hope that COVID is waning, but what impact does it continue to have for all of us? What's ahead, particularly for our children and for our families? Tonight, we welcome 4 civic and health leaders. First up, Quinton Lucas. He served as Kansas City's mayor since August of 2019, born and raised here.
Skip that.
He holds a law, he doesn't want me to do his introduction.
You're good.
He holds a law degree from Cornell and has been a member of the University of Kansas Law School since 2012, teaching local and state government law. Mayor Lucas has been an outspoken proponent of the library for many years, and often recounting how he frequented libraries while growing up in an impoverished conditions in Kansas City's urban core. Please welcome Mayor Quinton Lucas.
Good to see you.
Dr. Mark Bedell. Kansas City Public Schools reached a milestone in January, gaining full accreditation from the Missouri School Board of Education for the first time since 2011. Mark Bedell made it happen. He was appointed superintendent and now has served longer in that position than anyone in more than half a century. Consistency in leadership was cited in the accreditation, along with improvements in graduation rates and math and English language arts scores. Mark previously served as assistant superintendent for high schools for Baltimore County Public Schools and as school improvement officer for the Houston Independent School District. He was also a school principal in Houston and elsewhere. Please welcome Dr. Mark Bedell. Marvia Jones. She has worked in the field of public health for 15 years with a special interest in violence prevention and health policy. She was appointed director of the Kansas City Health Department in February, the first woman and the first African American ever to hold the position. She previously had been the health department's violence prevention and policy manager. And earlier in her career, she served a 2-year fellowship with Centers for Disease Control and Prevention, evaluating the effectiveness of prevention tools provided to state and local health departments. She also worked on the development recommendations for public health best practices. Marvia holds a doctorate in behavioral health and master's degree in public health from the University of Kansas. And in addition to her work in public health, she is also a member of the Kansas City Public Schools Board of Directors. We welcome you tonight, Marvia Jones. Paul Kempinski has been president and CEO of Children's Mercy Kansas City since September of 2018. He previously served as president of the Nemours Alfred I. DuPont Hospital for Children in Wilmington, Delaware, and before that, he was chief operating officer of Mercy Fitzgerald Hospital in Darby, Pennsylvania. A graduate of Penn State University with a master's degree in health system management from Rush University in Chicago, Paul is a member of Children's Hospital Association Board of Trustees and a fellow in the American College of Healthcare Executives. He serves on the boards of the Greater Kansas City Chamber of Commerce, the Ronald McDonald House of Kansas City, and KC Common Good. He is also a member of the Kansas City Civic Council. Please welcome Paul Kempinski. Finally, I'd like to introduce John Herron, the library's director and CEO, who will moderate tonight's discussion. We will leave time for questions at the end of the program in about 45 minutes. Those of you who are here can use a microphone right down here in the front of the seating area. Those of you at home can submit your questions via the YouTube chat, and we'll get as many questions as you have, both here and at home, answered as we can. Also, we ask that those of you here in the auditorium please remain to be masked throughout the program. And once again, thank you from the bottom of my heart for being here tonight. John, I'll turn it over to you. Thank you.
Thank you, Carrie, and good evening, everyone. And let me second something that she mentioned earlier. It is with great pleasure that we welcome you back to our library. Our signature public programming series, they are a cornerstone of what we have provided to this community for quite some time. And we could not be more excited, and in fact, more honored to see you here in our spaces this evening. But it's not just that we are happy to see everyone back, face to face, although we are that. Because over the next year, we also want to elevate our presence in this city. And we're gonna need your help to do that. We want to claim pride of place. We want to be top of mind. We want to be understood as a resource for social services, for economic development, for digital equity, workforce readiness, education, and literacy. And what I want to ask each one of you to do tonight is to serve as a library ambassador at large. If there was ever a time for community cooperation, it's now. And working together, I believe amazing things are going to be possible. I look forward to the many collaborative programs and partnerships that we could each build to serve this city. So if you have an idea, if you have something you want to share, do not hesitate to reach out to me for a conversation. So we also think that tonight's discussion, as we plan for what we hope will be a smooth transition to the post-pandemic phase of our life, is a perfect way to restart these community conversations. Helping us navigate through the known and the unknown are tonight's panel of community leaders that Carrie introduced so well. I want to thank each one of them for being with us this evening. So as we all gather here tonight, hopefully moving from the pandemic to the endemic phase of our lives, I want to open by reminding us of details that not a single person in this room needs to be reminded about. Since the spring of 2020, Americans have suffered one crude blow after another to our health, to our economy, and without too much hyperbole, to our confidence. The onset of the pandemic, an ineffective government response, partisan protests, social unrest, an election marred by violence, has left many citizens wondering not just about their families or about their communities, but about democracy. With ruthless precision, the last 2 years have laid bare the nation's challenges as well as how hard those challenges are going to be to fix. So with apologies for starting our conversation with such an impossibly large question, from the perspective of your sector, politics, healthcare, or education, I want to open our discussion by asking, what did you learn over the past 24 months about the issues that face Kansas City? Mayor Lucas?
I thought he was going with Paul first. And
Never know if it's going left or right.
I was going to learn quite a bit. There are many things to learn. I think one of the preeminent items that I learned very quickly was just how unprepared we are. I think all of us who found ourselves in leadership positions had to step up quickly, but also saw those things that we always thought would be ready, the emergency action plans, et cetera, how we distribute, whether it be masks, food, services, to our community was insufficient. And I think you saw a lot of agencies, both public and private, that had to stand up whole new delivery systems very quickly. And so I think what I learned was that we needed to be better prepared, we needed to be better invested and ready to provide services to everyone in our community.
Mark?
Well, for me, this pandemic and what we've been through over the last several years exposed us for where we truly were, which was a rigid, antiquated, outdated model in how we respond to meeting the needs of our students and our inability to pivot as fast as we needed to pivot. And it really became a major concern of mine when in 2015, before I got here, was when we said that we were a one-to-one school district from a device standpoint. But then when it was time to be one-to-one, when we shut down schools in March of 20, or was that 20? I remember March 12th, 2020. That was the last time that we were in school for nearly over a year. And we had to send packets home because we didn't have the infrastructure from a digital standpoint. We also didn't take into account that even when we did get the devices, that we also had Wi-Fi deserts. So sending home devices without connectivity was even worse than sending home packets. And so it really exposed us just around the dependency that this community has on the school district and how we have to make sure that we're much more agile and flexible moving forward.
What, from a population health perspective, what I think we have learned is, similar to what has been stated by my fellow panelists, but also it just taught us how far towards the edge so many of our residents actually are. And so whether we're talking about where they are from a physical standpoint, so maybe they're living check to check and the slightest disruption in their income or their employment situation could wreak havoc on their households. And so we saw a lot of that going on, and we're glad that the city was able to rise to meet those challenges and help with some food assistance and utility assistance, all of that. But it was just a great reminder that some of the typical things that we can lean on, such as the Wi-Fi. Hey, go here and sign up for your vaccination. Well, if you don't have Wi-Fi, you also don't have transportation to go get your vaccine. Those are all issues that a public health system has to consider when we're making decisions. And then I take it all the way from the physical needs to the mental health needs. It also showed us that people are really on the edge when it comes to their mental health. They were already there before this pandemic, and the whole situation is people were losing loved ones. There were these new restrictions. There was just this anxiety that we were all dealing with as a society. And those things have pushed people to an even, I think in some respects, poorer position. And so these are all things we know that we have to invest in.
Yeah, so I always like to begin with the positive, and we could say very easily that there are no positives that came out of the last 2 years, but I think there are a few, and I would point first to the opportunity that we leveraged to collaborate and partner throughout the community to address something for which there was no playbook in the past unless you've been living over 100 years. And the way that our civic community, our academic community, our public health community, and our healthcare communities came together to respond, be nimble, to experiment with potential solutions, and to respond on a dime to something for which we had no experience, I think was incredible. And I think it served to bring the community together in ways that we haven't experienced, despite all the opposing forces to that. Secondly, and shifting back to the negative and really building off what Marvia has just said, we learned that we knew that there was a silent epidemic that was occurring in the lives of children and youth, and that is an exacerbation of mental and behavioral health issues. Over the last 2 years, that epidemic has surfaced above the waterline and really has been exacerbated as a result of the pandemic. And the statistics, which I keep with me very often, are sobering. But I think we can all agree that the impact on the mental and behavioral health of our children, and for that matter, the entire population as a result of what we've experienced over the last 2 years, is concerning, tragic, and sobering. And I would imagine that everyone in this physical and virtual audience has a story that they can tell that is close to their hearts, either impacting them, their families, loved ones, or friends, about how this epidemic is rising above the waterline. We must address it. And if there's anything good that's come of that, it is that it's risen above the waterline and now people are talking about it, and we're talking about actions and not just statistics.
Why don't we build on that for the next question? And because so much of the national conversation about COVID has been a catalog of numbers. It's been positivity rates, it's been number of tests, it's been available ICU beds, it's been the unfortunate weekly death count. I just saw the WHO put the worldwide figure at 6 million, which I'm sure is a dramatic undercount. So this, and yet as Marvia and Paul just suggest, there's an equally significant cost that is not so easily quantified or even seen. So community stress, anxiety, mental health. Maybe from the city perspective, Quinton, how did those issues affect your approach to city government?
It made it for all of us, and I don't think city government is unique, it made everything vastly more difficult. There was a pervasive sense of negativity for a long amount of time, and I don't say that as a critique of the public or of our workforce or of anyone, but there was just this kind of lingering depression and dejection of many. I'll give a vignette that at least puts some levity to it. During the pandemic, you'll all remember that our governors in this region, Mike Parson and Laura Kelly, would do daily press briefings, usually televised. At the local government side, we often would as well. Myself, Dr. Jones's predecessor, would speak usually at noon every day. One day I got this wonderful email from a woman in Leavenworth, and she said, "Mayor, thank you so much for your updates. It helps us feel calm, etc. But every day you have a press conference, it preempts Days of Our Lives." and she said, "With everything going on in the world today, I really just want to be able to watch Days of Our Lives. Could you move your press conferences?" And I actually thought very deeply about it. My staff said I could not. But I think what you saw, and not to make too much light of it, but there were joys in it, was this sort of moment where all of the things that we used to rely upon to bring folks together, a parade, an entertainment event, a movie that you bump into people at, wasn't occurring. And indeed, even the things that purportedly would bring us together, like an election, which just kind of tore us completely apart. Yeah. And so I think it was much more difficult. But on the whole, I think a lot of folks, when we excluded those who were more on extremes, who wanted to create hyper-partisanship in how we address the pandemic, of which there were more than a few, I think when you remove that, most people said, we will get through this. We've been through challenges before. And that certainly helped me survive through the last several years as well.
How about in the school district? Did that?
It was debilitating, in my opinion, for school districts. 1 in 4 superintendents have resigned in the field of education. There are vacancies all over the country, and you often found yourself in a position where you couldn't do anything right, and in some cases you couldn't do anything wrong, depending on what 50% of people felt that the decision you were making was the right one. And what we tried to do in this school district was to be as methodical as we could be and as sensitive as we could be to meeting the needs of the community. And in doing that, we felt that we tried to collaborate with well over 300 people when we put out our initial plan, when we made the decision that the only folks who would be in school were our pre-K students last August or August of the previous year when we were out for a full year. And we think through the collaboration that we had a plan that our board accepted. It was actually a plan that got shared around the state. And we found that in navigating the pandemic, even with all of the frustration, with people in here, what I could say to everybody, we weren't on the news for people protesting us. We weren't on the news for people coming in and acting out over our masking position. We stayed closely to the data, and we tried to allow the data to lead us to where we needed to go. And that way we didn't find ourselves having to pivot back and forth, so people wanted consistency. And we felt that we were able to give people that consistency through the pandemic that really has allowed for us to be where we are now, where tomorrow night I'm ready to tell the board that it is time to go to mask optional because, you know, the data is telling us that that's where we should go. But we did it our way, and we did it in a collaborative manner, and I think that eliminated, you know, some of the toxic stress that other superintendents have experienced around the country, and even in this area, when you look at the number of vacancies that we have just in this area alone.
So maybe we can, your two worlds probably deal with mental health in a much different way than those two worlds. So maybe we can think about how did this sense of, as you call it, a children's pandemic, mental health pandemic, how did you see that in Mercy's day-to-day operations? Like, how did you see that anxiety or that stress impact your patients?
Yeah, it manifested itself in many ways. You know, healthcare providers have been at the epicenter of this pandemic in a number of ways. First and foremost, we prioritized every day the safety of the patients that we were caring for and our own staff and the visitors who were coming into our facilities. We relied upon the data, and we have to acknowledge that the data was evolving and the evidence was evolving almost on a 24-hour basis. So there was no book of science that we could open up to page 50 and say, here's how we do this. It was literally evolving. But with all of the stress that came for caring for patients, now, you know, COVID, thank goodness, has not largely been a disease of children. But nonetheless, we had hospitalized children and hundreds of children who were coming into our clinics and our emergency department. But while we were trying to support those 8,500 caregivers and those that were supporting that care, we also realized very quickly that those people are mothers, fathers, brothers, sisters, grandparents themselves, and were facing the same stressors at home that they were having in turn to deal with while they were in our hospitals and our clinics. So that created a problem on two fronts for us. One was to support the needs of our patients and to make safety paramount, and secondly was to support the well-being of our staff, which was increasingly being compromised and stressed throughout the pandemic and continues today. So that's been the biggest challenge for us, but I will say that first and foremost, we learned very quickly that the well-being of our workforce was most important in order for us to provide the best care to the patients and support our families in the best way possible. And candidly, I'm incredibly proud of the way our organization and its people have gone through that, albeit under great stress and with many challenges and many unforeseen circumstances that required us to pivot along the way.
Marvia, how about from your perspective, how do you see, even with the newness of your position, how do you see dealing with this other side of the pandemic influencing the policies that you're going to create moving forward?
Yeah, there's nothing like a pandemic to humble public health, and to make you feel less smart than you thought you were. We have incredibly smart people at our health department, don't get me wrong. An incredibly well-trained public health workforce in our city. But what this process really taught us is that we have to really think about how we're speaking to people and how we're taking into account their mental state as we're trying to give them recommendations and information. So what we have realized is that sometimes we can talk over people's heads, and so when you do that too many times, people can write you off. And so if someone feels unheard or unseen, in even your communication, we've learned that that can be a problem. So that's something we are working through, and I'm very happy with the progress we've been making on that. But also, as was previously mentioned, the emphasis on the mental well-being and the wellness of the workforce. That is incredibly important when you have disease investigators and contact tracers who are getting hung up on, and people aren't very happy with them, and we suddenly become the people that always have bad news to share publicly. That can put you in a very unhappy place. So we've definitely we're now working to build ourselves up, build up our workforce so that they'll be in a good state to address the next thing.
So looking at the physical manifestations of COVID, obviously the mental costs of COVID, an often quoted line, and I probably won't get it exactly right, from Bishop Desmond Tutu might apply here. There comes a point when you need to just stop pulling people out of the river. You need to go upstream and find out why they're falling in. And you just think that in this dynamic, we've got this combination of a physical blow, which is seen and quantifiable, and this other set of stressors that has impacted our community in a very big way. Not getting too far ahead of ourselves, but let's say we're not throwing our masks away, but we're putting them in storage, hopefully for a long time. But how do you think each one of your institutions will respond differently if in some time in the future we have another variant or another wave? Paul?
Yeah, so first of all, I think we are so much better prepared right now to manage surprises that may come our way, both in terms of infrastructure, in terms of talent, in terms of coordination inside our organization, coordination regionally, and even coordination nationally. We are, with the support of the President's administration and Congress, we are hoping to be part of a national pediatric pandemic coordinating body that will help coordinate responses for children's hospitals across the country should this ever happen again. So I think we will be very much better prepared. However, I would raise a cautionary flag. When you have something that occurs every 100 years, you tend to forget what you've learned over time. And I think we're going to have to get better at being more mindful and more intentional about trying to practice what we've learned and simulate so that we don't forget the lessons learned and have to learn them all over again should some other surprises come our way. But I think the preparation is leaps and bounds above what it was 2 years ago. And I would go back to the level of coordination and collaboration and partnership across the region, across the states that we serve, and also even across the country.
Marvia?
Yes, I second that part, especially about the collaboration. We definitely need to maintain all the partnerships we've built up during this process. I also would like to, and what we'll be working on, is building more ambassadors in the community for public health. One of the big things that we learned is that a lot of people have not developed a lot of literacy around health. And so it makes it very difficult to communicate with them about what needs to happen to protect themselves if they don't have that sort of baseline level. And so one of the ways that we can build that is by having more people in the community who see themselves as a part of public health. We can, pass our messaging to them, help them understand so that when they're at the kitchen table with their families, they can talk to them about, things that they may not have understood before. Hey, this is how a vaccine works. This is how a virus differs from a bacteria-based disease or something. And so I think that will be something that will situate us better for the future.
So besides changing the time of your press conferences, what do you think the city would do differently? Or will do differently if we find ourselves in this position
Right.
again?
I do think that our relationship with how we communicate with our constituents has changed. In many ways, what Dr. Jones addressed is much of what we need to do as well. To receive city services, you had to come to the city. You had to come to City Hall. You had to come to the health department. And we saw the shortcomings of that approach. And so I think you will see forever changed, for example, how accessible we make our meetings. which is a positive that's come out of it. How we interact with our staff and engage with them, particularly when dealing with illness. Right before, and many of us as employers, kind of had a more punitive approach. You only have so many sick days. We're encouraging you to come and spread your illness at our workplaces. Right? I think we've all learned that maybe it's better you stay home. And so I do think that we'll take from all of those something special. But I will ask a favor, I would say from you, historians, in the sense that I have, I studied history in school, but never in depth enough. I would be talking to our health director at the time about how does this end, right? How does a pandemic end? What do we do next? How do we find our way out of it? And we were looking for scholarship from the 19-teens. We were actually looking at really old articles. And so I do hope that we have more moments like this with more institutions about what they did right, candidly what they did wrong, so that whenever the next thing comes up, whatever it may be, someone can look at a template.
Yeah, who knew being an American historian would have such powerful social cures? Mark, how about the school district?
Well, there's so many things that we will do differently moving forward. To be honest with you, I talked about how rigid and antiquated we are, and part of what we're going through with Blueprint 2030 is to allow us to be a lot more innovative and a lot more flexible. First thing that we want to do is take a look at our start times, right? So we are engaging our parents. We probably have another 15 days or so before we can bring a recommendation to the board to look at starting high schools a little bit later than 7:20. A lot of research out there told us a long time ago that we should have done it, and we didn't do it. I think there's another a factor that we have to look at. What does an actual school day look like? Why do we constrain kids into a 7:20 to 2:20 schedule? Who made that decision that that's the only time that you can go to school? And what I learned from the pandemic is that we have students who were able to work while also being able to thrive virtually. So they were able to help make ends meet at home while also being able to get their education. But the way our system is set up, it doesn't embrace that type of modern way of how we conduct teaching and learning. So we have to blow up what the school day looks like. High schools need to be 8 a.m. to 8 p.m. And we need to offer flex schedules by the time these kids get in the 11th grade, where maybe they're coming in 8 to 12. And then they go and they do an internship 12 to 4. So now you control for the variable of poverty, where many kids who can't work or do internships because they have to take care of siblings at home or they have to work, now we can build that into the actual school day and let them take 2 or 3 classes that they don't need to be in front of a physical teacher, but could have an online teacher that works with them maybe at night. And so we're looking at those kind of things. We want to look at the calendar. We're challenging the state on seat time because we're funded based on a kid sitting in the seat. We got to blow that up, and we got to look at what are other ways that we can get our funding, but also be able to innovate, because state statute right now still constrains us from being as flexible as we want to be. And those are the things that we're challenging and pushing on now that we've gone through this and gotten a taste of what could be.
So perhaps more, I'm not sure if this is controversial or not, but I think one of the other casualties of the pandemic is a loss of faith, a loss of trust in community institutions. And maybe we can use Mercy as an example, because it's unique maybe among the panelists, because Children's Mercy is obviously a local institution, but it has a national, in some cases even international reputation. Have you seen any impact of this loss of trust from society at your institution?
Sure. I think it's been an unfortunate pendulum that has occurred. In the beginning of the pandemic, our caregivers were so immersed in addressing the needs of the patients and the families that they were regarded as heroes, right? We heard the term heroes, and I would still regard them as heroes. And then in the latter stages of the pandemic, we began to be criticized for putting into place vaccine policies, masking policies, and other restrictions and policies that were all intended to protect the safety of our patients, those who come inside our walls. So I think unfortunately right now, in the eyes of many, there has been a loss in confidence even within the healthcare systems at large that has impacted us. But I would say that, from the perspective of our workforce, I can't imagine going hand in hand in battle with the pandemic with anyone else other than our 8,500 employees, because they have committed their livelihoods, their professions, have sacrificed their own personal health at times to ensure that the children of this community get the best care possible. But it has been a pendulum. In fact, even when you look at some of the activities that are going on within, state and even, governments beyond, there are policies and bills and pieces of legislation that are being introduced that are intended, perhaps with a bit of overreach, to address some of that loss of faith and confidence. So somewhere we have to find that equilibrium to both honor and respect those who have given so much during this pandemic, and yet acknowledge that we have things that we can do better systemically from a system standpoint to prepare ourselves to support our workforce, to support the mental health of the children that we serve, and to really be better stewards of the community. So, no question.
Mayor Lucas, similar question. I mean, even the cynical or even the skeptical are going to look to the government to protect the economy, to protect society, and yet there's still going to be this skepticism toward probably everything that comes out of your office. Have you seen a connection between the pandemic and a loss of faith that the government is here to help?
I've seen that my entire life.
Right, I was going to say, I'm going to make a regular quote there, but yeah.
But to the point, and as I've been listening, I have thought about the fact that you can still ultimately, even if it seems unlikely, trust the people to get it right. Sometimes it takes a while. Sometimes you have to make sure that you're trying to offset other voices, but I think it can work. I'll give an example from my own experience because it's what I know best. Early in the pandemic, I think as early as about August or September of 2020, a group of Kansas Cityans learned about the recall process and started setting up at your nearby Applebee's or Costco parking lot with signs of "Recall Lucas." And they tried a first time and were unsuccessful. And they didn't need that many signatures. In a city of 500,000 people, they needed 13,000. They usually got to about 3,000. And then they tried again. And again. They tried 5 times to recall myself. And most of the time when I would hear about it from other folks, even folks that have strong political differences with me, they'd say, that just doesn't seem like the way things should be. We elect a mayor, we have a superintendent, we have others. We want them to be in those positions. Now, we may disagree with them, we may debate them, but they still exist there for some reason. And so my view has been that while there have been many questions about organizations, the CDC's asked about all the time, our local health departments, et cetera, I think fundamentally a majority of the public, and I might even say a supermajority of the public, have continued to say, well, there is a reason for trust. And I think you still saw it in every time we would have a mask rule. There would be some people who would try to organize a protest at a restaurant and take them all off in unison. But most people, even the folks, I have some friends who are the types that don't like those sorts of things. Why would we wear a mask at Arrowhead Stadium? But at least for a season they did. And I think so there is still some belief in institutions, and I think for those of us who work in them, our role has to be that we continue to share information, share where we're right, where we're wrong, where changes need to be made, so that they continue to have that trust in us.
So Marvia, for you, this has real weight, because how do you maintain the public trust during an age of competing narratives, competing misinformation about healthcare, vaccines, and everything else?
Yeah, before we came on, we were joking about don't click on Twitter, the other replies thing. I often made the mistake of doing that, usually late at night. Makes good, peaceful sleep. But I think this is something we are grappling with. The scientific process and the process of getting new information, especially by something as novel as a COVID-19 virus, that in and of itself requires constant iterations, it requires change. I think that, to the mayor's point, what we can do a better job of is definitely sharing information as quickly as we can, but also going back and sharing, okay, we might have made a misstep there, or we've learned something else here, and not making it seem as if, okay, we'll just let this drop off the radar, but stick with doing what we said we would do, months ago. Just keep with that. I think that definitely causes some mistrust, and so that's something we're definitely working through.
So Mark, reaccreditation, I'm sure gave you a nice present, a nice gift of trust, which has probably been spent down already, and it went very quickly. How
Day
about,
after.
Yeah. How about you? How do you see it in the school district? How the public perception of faith in the institution or trust in the school district to do what's right?
Yeah, can I just go back to
Sure.
something the mayor said about the recall? Because
signed one of those?
those same folks came to my house, and my wife said, get off my porch. But I played basketball with him in the mayor's night out, and had they come back, I would have signed that recall after playing with him.
Can't win them all.
I know. But to answer your question, in the school district, we have, I'm doing a lot of research on the school district right now because I'm working on a project that I have to get in with a compilation of our journey from when I got here to the work, to becoming fully accredited. And I would say we started losing a lot of trust in the late 60s, early 70s during the integration period. And then when you had the whole situation with the $2 billion judgment that came across on the school district, and people felt that they were being cheated out of an education in this school district, it's been a long journey of distrust. And I said this earlier today. I was on a call, Links on the Hill, and I am asking for help. There are people who have lost complete trust in the school district well before the pandemic, just because they felt that they were cheated out of an education, and they feel that the system repeats itself over and over generationally. And what we're trying to do is say to people that no, the school district is operating different. We got to figure out how we help people lower their guards. So just getting accreditation doesn't necessarily heal the heart. When you think about the amount of pain that people have gone through, there's going to require a lot more intentionality. I think people were very pleased with how the district responded during the pandemic, putting cafeteria workers on school buses and driving into the community and doing things that weren't within their job description to feed into the community to make it a little bit more convenient. But this has given us a little bit of leverage to dream boldly and to perhaps do some things to dismantle the system, as I've said earlier, based on the way that it has been designed to not necessarily educate everybody at the same level and have everybody in mind in a very fair and equitable manner. And it starts even with the work that we've done with our handbook. You know, our board member here, our colleagues from Moore Squared, they pushed us. How do you look at your handbook differently and look at it from more of a restorative standpoint? How do we help restore social and emotional distress rather than punishing it and telling them we're kicking you out? Because that's what we've done for decades. So we think that we're headed in a direction to restore it, but we have such a long way to go, and I need help with it. I'm just saying that to everybody.
Well, speaking of a long way to go, I opened with an impossibly large question. Maybe we'll kind of close our half of the conversation with another very large question before we open up to the audience. But regardless of political position, a sustainable future for this city is going to require progressive leadership. It just is. So with that in mind, speaking for your institutions and your sector, what goals do you have for your institution in the kind of medium and long term? Like what are you forecasting out in terms of what your institution is going to bring to the city in terms of what's really going to create a positive and progressive future?
Yeah, so I want to go back to the mental health issue here. So on March 11th of 2020, our board approved a brand new strategic plan for Children's Mercy. 4 days later, we began to shut down services because of the pandemic. We paused for about 2 weeks to reflect on that plan and concluded very quickly that plan remained bold and relevant for our future state, because while we had to manage during the pandemic, we felt we had to lead toward the future. One of the pillars of this plan is what we call community impact, and there's two components of that. One is related to population and community health. So we will never lose sight at Children's Mercy of providing the best care available for the child at the individual episodic level. We do that as well as anyone in the country. But we also know we have an obligation to better support the quality of life and the health status of the communities that we serve, especially where children who are most vulnerable reside. Those kids who may not be guaranteed the most access, the best outcome, the best experience. We have an obligation to do that. That's a commitment of ours. Secondly, we have to address this epidemic of mental and behavioral health in children specifically. So our plans are to go big and to go bold in terms of expanding services, developing our workforce, partnering with our community stakeholders to make meaningful impact on this epidemic, which has impacted tragically so many children and families, not just over the last 2 years, but really over the last 15 years. So we will be expanding programs and services. We will be expanding our workforce. But there are 3 components of our mental health strategy that are important to me. One is we actually have to move the needle. This can't be checking a box just to say that we did things. We actually have to make an impact on the quality of life of the kids and the families we support. Number 2, it has to be sustainable. The reason why more healthcare providers are not deeply embedded in mental health services is because they are largely under or unreimbursed. You don't get paid to provide them. So unfortunately, that's been an incentive for providers across the country to de-emphasize them. We have to mainstream the provision of mental health services and not look at mental health as an individual swim lane or a specialty, but it permeates everything we do as a healthcare provider. And then thirdly, we have to partner and collaborate with stakeholders across the community, other providers, the public health community, our academic institutions, folks like Mayor Lucas, our state leaders and our federal leaders, because we can't do this alone at Children's Mercy. But we are committing to the community that we will do much to invest at the community level, the organizational level, in homes, in schools, and in so forth in the community-based pediatrician environment to address this issue in a meaningful way. It's going to be a long-term journey. We're going to need the help of the community, but that is an important part of our future vision and plans.
So Mark, if you put that strategic plan in an educational context, it doesn't sound too different from your 5-year strategic plan.
Well, the mental health aspect of it definitely aligns with where we want to go and how we want to become a truly trauma-informed school district that does have the ability to control for social and emotional distress that often becomes an impediment to students reaching their full academic potential. But I think where we are heading with Blueprint 2030, that's going to look significantly different. Teaching and learning will look different. We want to become a true project-based learning school district that manages to take state standards and package them in a manner where interdisciplinary learning is real. I can have kids that are over at Wheatley Elementary figuring out how to solve community-related problems through the way that the curriculum has been designed. So it becomes real world, and then I can send them to the mayor's office to advocate on behalf of what they want from city council to enhance their communities. We got to bring joy back to teaching and learning, and we haven't done that. We still have these kids coming into some of our schools, and they are a chalkboard era type environment that they are forced to learn in, and that's just not the world. So we bore these kids to death, and that's why you see a number of kids become disengaged and they quit. But it also requires that we educate our teachers differently and show them how to have joy in teaching. Make it come alive for them. So it's about curriculum redesign. It's about, as I said earlier, looking at the school day differently, looking at the school year differently, and then making sure that we work with partners to open the world up to kids. Right? My kids, we can go on a cruise. I can take my kids to Disney. We can afford all of that. But I got a number of kids, they've never even left the city. So how do we work with all of this philanthropy we have in this city to say, okay, we're doing all of these interdisciplinary type learning, but there's going to be a culminating project at the end. But it's also experiential projects where these kids, where we can open up the world to them and let them see things and let them see that there's more to this world than just your zip code, which happened to me. I didn't go anywhere until I went to college.
Marvia, how about if, when you're looking forward, again, you're the newest professional member of the panel. Like, what are your goals as you sort of look forward for your department?
Yeah, one of the beautiful things about the field of public health and what is supposed to set it apart from the healthcare or medical field is that we're supposed to really lean into all of those things that surround people's health status. And so our whole philosophy is that health is not just the absence of disease. And so we really want to lean into that and supporting some of the things. So some of the things Dr. Bedell just talked about as far as people who haven't left the city. Well, we have data that shows that being out in nature, being in a beautiful green space, all of that improves your mental health and your well-being. How could a health department partner with the school district or what have you to make that happen? And that would serve our staff, because we definitely, as has already been mentioned, we want to make sure that our staff are in a good mental space, but it also feed our community. And so we want to think about more things like that. So we're not just a place that tells you, hey, you know, someone had an STD, you might want to go get tested, or, you know, talking about COVID. We want to build those things that will increase people's health status and their well-being outside of just a diagnosis.
I don't want to minimize this, but I was participating in a webinar this morning, and it was a survey of 200,000 Americans about what they need most emerging from the pandemic, and they distilled it down to a word cloud. And the reason it popped into my head is because the word is the word that Mark just described: joy. Like, so it wasn't health, it wasn't a good-paying job, it was like this profound lack of joy over the last 2 years, and now that Americans are looking forward to that kind of dynamic. All right, last word, Quinton. What goals you want to put in place as we emerge out of this pandemic, to make sure that the city is well established to become a progressive community that you hope to build?
You know, the words I think of are, how do we communicate? So communication and information. How do we make sure we're sharing truth and sharing what's important, but making sure that we're relating it to people in a way that all can understand? I think back to when I was running for mayor, you run this poll to test the issues. And in Kansas City at the time, in 2019, 70% of folks were concerned about potholes. The next most important issue was crime at about 20%, education at 5%. Now you could leave that and say, oh my goodness, this is a terrible place where all they care about are their cars and their rims or something of that sort. Or you could say, well, for some reason we are not communicating the change that can be made in education. We're not communicating the change that's possible with public safety. Mm-hmm. And what we need to make sure we're doing is saying how important these things are to actually your daily quality of life, to how we build a better and stronger city. Fundamentally, if we have strong schools, a safe place, a great economy, a great healthcare system, believe it or not, the potholes may ultimately take care of themselves. And so what I have tried to do, and I think where governments will try to go, particularly, and this is not a talk about journalism and its future, but as journalism becomes just this more disparate back and forth battle, we need to make sure from all of our institutions that we're sharing information of what we do, why our investments matter, why we're actually shouting about public health or education that day, and fundamentally, and this is the thing that breaks my heart the most as mayor, and I know actually all of us deal with it in our different jobs. When you talk to a bunch of people who think this ain't ever gonna change, when they say, oh, Bedell, I've met 15 superintendents, y'all always gonna be the same, and despite the accreditation, right, he deals with that still. I bump into people who say, I'm from these streets, they always are gonna be just like this. And for us, I think what's so important is how we share the information of what we're doing, where we can be, and that we work harder than anything on communicating the possibilities of this city long term, and how special each and every person in this city, the child, the person on the streets, the returning citizen from incarceration, is in helping us get to that future.
Okay, thank you. So again, we're open for questions. The microphone there. Steve, I think, has questions from the online audience.
We do. While we're waiting, we have one question from somebody watching at home. They want to know, were there any steps that were taken that you look back on now and think maybe that might not have been worth it because the cost socially or economically might have been greater than the health benefit?
I always feel like that's a school question.
Yeah.
I don't think it is.
Too. Me too.
Ask that question again.
Were there decisions you made that you now think you regret? Either they were too costly, they were impractical?
I would point maybe nationally to the early on we thought that masks wouldn't work. And obviously that was a misstep in all of this. But was there anything locally that you think we shouldn't have done that, or do you think we got everything as right as we could have given the circumstances?
Look, I'm not trying to make it sound like we were perfect. As I started off, we weren't protested against, and we didn't lose a lot of teachers because of how we handled this. We have districts that may have over 100 vacancies. That's not us. We're sitting at like 24, and that's significantly lower than what we had before the pandemic even hit us. And so I think that I don't even know at this point, because we're going to see how this all plays out with our Kansas City Virtual Academy, and we'll see what enrollment looks like in that program and the evening school that we just started. I think those are things that we'll have to take a deeper look at from a sustainability standpoint, because we have done some things that we're moving and doing differently that we think will be a part of our school district. But I think over time, looking at those enrollment trends, because now that we're starting to go to opening things back up, I do wonder how many parents will continue to keep their kids in the virtual academy or even at evening school model. So those are things that we will have to monitor and see if it's feasible to continue to do.
Rightly or wrongly, I have a lot, but I will only, I think, speak to two. One relates to schooling, and this goes back to my perhaps kind of fluid communication point. Early in the pandemic, not early, a few months in the summers, we were preparing for the school year, I believe 2020, 2021. There were a number of people that reached out to me and said, well, our private and parochial schools are opening, and they're opening with safeguards or any number of things, but why should my schools be treated differently? And why is there a different discussion for some of our public schools? Not necessarily a Quinton Lucas choice. And I think the response too often from those of us at the city level, myself, the health director, and others was, that's not our choice. So, go ahead and kind of think of these divisions that you see. What we didn't explain enough, and where we were in the unique position to do so, was to tell to parents why we're seeing different choices being made. We didn't need to say objectively what was right or wrong, but I think that could have helped, because I think people left from that feeling thinking, oh, I should just, if I have the wherewithal, send my child to a different type of school or something of that sort to avoid the problem. And indeed, not particularly in Kansas City Public, but in our Northland districts, we actually saw a good amount of that and folks looking for that option. One other very quick mistake, I think a number of institutions ran into a challenge with how you treated your workforce during the pandemic and how they felt valued. And we had a substantial decline in revenues. I think all of us might have for a little while. And for us, we were very quick to run to, and necessarily, to furloughs, to any number of challenges, to hiring freezes. But I don't think we shared with folks how they are still valuable, how they're still important. And I think it has left still a taste with many city employees of them not being that useful and respected by the institution. And that's something that we'll have to address for years.
Oh, how about at Mercy, given the...
Yeah, I think we have to be careful not to beat ourselves up too much. We were making decisions at the time based upon the best information available to us. But I would agree with, the mayor. We had to make some decisions with our workforce at a time when our volumes plummeted 75%. We were literally losing $1 million a day for 3 months. The problem was we didn't know when it was going to end. So we did make some decisions with respect to furloughs and addressing workforce issues that when I look back upon it, if I knew what I knew now, they may have been different decisions. However, when you look back upon what you did know at the time and having to, protect the organization, the safety of our patients, I think we did the very best that we could. I think, we also learned during this that the toll that this was going to take on the well-being of our workforce. As we learned that, we responded quickly. But learning that connection between those who are providing care and also being parents and brothers and sisters and loved ones at home, to know that they were essentially being impacted so dramatically on both ends of the spectrum was a learning for us too. And once we began to realize it, we addressed it quickly, and I'm proud of what we did. But
Good evening. My name is Laura Dominic. I'm a trustee on the Board of Trustees representative from Independent. So first of all, thank you for coming out to our first ever back in 2022 here to see everybody. My healthcare background always taught me, or I believed, that public health in time of crisis should be over politics. I have seen, and if you ask any one of the independent city council members, they can tell you this, they'll say, well, I'm sure you've been speaking to Laura Dominic about that question, is that we have seen the reverse, where politics has become over public health. And not referring to politics in the big D, big R, classification, but actually in our local areas. For me, I felt a frustration that the people who are public health, who understand public health, the people who are the doctors and the healthcare providers, have been constrained by what's been going on in particular in our state government, because that does impact your school board and your work, and of course your work. I'm wondering how you have felt that, if you have felt that constraint, if you think that should change, and maybe how it could be addressed going forward. Thank you.
Yeah, I can start. I can say that I keep reading they're not ordinances, the pieces of legislation that come from the state so I can stay out of jail. I've been doing a lot. I'm just being honest here. Yeah. I almost have to do a weekly bulletin. Okay, what's going through this week? What can't I do this week? And so I think that has been something that maybe makes people in this position and others similar, makes you just feel nervous. You want to share information. I can't say that I've felt too much of that lately. I think that the national press has done a lot, and we've been able to get our messaging out about our local issues. So thankfully I haven't, run into that a whole lot, but it does make me think about the future. So if there is a TB outbreak, for example, or something else that's a smallpox or something like that, how will I be able to communicate about that? What will be the constraints on our department about communicating about that and making recommendations or what have you? And so it makes us nervous. It makes us become readers of legislation a lot more. But I think that it also has made us a little bit more creative on the flip side, because we have to think about what are those other channels where we can gain the trust of the public, so that when I have to go to them and I can talk to them and our staff talk to people, they will listen, and we don't have to resort to some of the restrictions or some other things that might have been in the power from a health director in the past.
I would just say that I never felt constrained, by the environment during the heat of this pandemic. We always felt that our most important role was to be the resource on child health issues for the region. And we were very respectful of the fact that, we didn't have the authority, nor was it our role to make decisions for the school district or decisions for the city or decisions for the suburban areas. But when we were called upon to provide advice, consultation, data, information, we felt that was important, that we carried that out well. And we tried very intentionally to ensure that we were sifting through the political fog and relying upon the data, the evidence, and the best information available at the time. We also tried to be honest that it was evolving. The science was evolving. The learning was evolving. So I believe we did that well. And while, I wish that there could have been, perfect coordination between Missouri and Kansas on how to manage it as we sit on State Line Road, certainly that would have been a great panacea to strive for. But given the circumstances, we never felt constrained. And we hope and we believe that our role as the children's health resource for the community was carried out well. We did it with respect for the stakeholders that we were supporting, and we were being true to the science and the evidence that was evolving at the time.
We think things tend to be nebulous, right? And you got to figure out how do you clear the air and move the smoke screens and get all of that out the way and keep the focus on the main thing. We've always tried to keep our focus on what we need to be doing for kids, even in the midst of how legislation and how politics, in my opinion, have kind of morphed, and they've taken some issues and they've turned them into things that weren't a problem 30 years ago are now major problems, and it's the talk of the country. And how do we try to keep everything just focused on doing right by the children that we serve? And even as we went through this pandemic, knowing that this was an opportunity for people to use politics to try to get certain issues on their agenda, you know, through both sides of the House, we stayed firm in our collaboration here locally with all of these folks that are on this stage, but even with our charters, right? There's a lot of talk about charter funding and all of that. We said, look, we're going to work together on behalf of children. And that's a position that I've taken that has been quite frankly different than what other former superintendents have taken, because what I care about are the kids. And I want to make sure that every single one of these kids get what they need. And so I try not to allow for what I think legislation that is often designed to divide us, and it's even trying to divide us in St. Louis because we're not on the same playing field with how we see this educational ecosystem. We're just not going to let that happen. And that's the way that we've kind of navigated through all of it, is to keep the main thing focused. The main thing is the main thing, and that's children.
And I'll just say very briefly, I'm sure we'll hit time at some point. For those of us who actually are politicians, right, who inhabit that world, the first thing you had to do was gain some amount of bravery. And it is not me wearing anything proudly about it, but it is just, if you trust the health professionals who are giving you guidance, we have health directors for a reason and others, then you realized sometimes you would make a decision that would be exceedingly unpopular for almost every bar owner in the city and so many others. And so that was a step one. But the other thing that occasionally would assist me was when you saw opportunities for bipartisanship in connection with a message, try to herald those. Then President Trump, right in, I think, April, in one of the more lucid press conferences he gave, said it's going to be a tough 3 weeks and we all need to probably shut down for a while. Now, he gave a press conference a few days later and said something different, but for that moment, it seemed as if everyone was taking the pandemic with a level of seriousness that I think it required, and so did we. And really, there are opportunities for leadership in that, when you can say we are aligned, this isn't left-right, this isn't some distinction of areas, and I always try to find opportunities like that. We had moments like that sometimes with Governor Parson, other times we didn't. For us, sometimes in Kansas City, Missouri Public Health, that would mean we would align with Governor Laura Kelly in Kansas, because they're next to us and we are in the same media market. And so you try to find enough situations where there is still a strong message of, we're just doing this because of truth and data. And I will make one final point on this, and I'll center it around football. I love football. I like to go to every game and all of that. And I would try to tell people, I am like you. I want to be out. I want to be watching sports, not playing basketball, but I want to be watching. And just right now, it's important for us to do something different. And I think that was usually how we could at least show that level of seriousness, so they weren't just saying, oh, this is just some crazy doctor that's telling us things, which is odd because we trust them with everything else. But instead, it is actually something that all of us believe in is necessary for our health and safety.
We have one more question from somebody watching at home, and this kind of plays into the mayor's answer to a previous question. The chamber recently held a discussion about their staffs being exhausted and unfulfilled. What plans do you have within your own workforces to bring people's passion back?
Well, I'll start with that one. I think it's what I said earlier. First of all, we've shown a deep appreciation for our teachers and our faculty and staff. We have been very generous with pay raises over the last couple of years. We took care of SROs, our school resource officers, last year. This year, our teachers are getting probably a 4% pay raise, and they deserve a lot more. I've been advocating since I got here that teachers aren't paid enough. And I was one, and I had to move into administration once I started having kids in order to make sure that my ends met. Otherwise, I'd probably still be a teacher because I was a far better teacher than I will ever be as a superintendent, and that's just the fact. And so we want to take care of our teachers, and then we want to work on some of those mental health, the restorative things, looking at, I told all of our teachers, principals, load up your teacher lounge. Gift them every day. Do what you can to make people feel that they're valued and appreciated. Take them to the teacher store and take them on a shopping spree. You just don't know what that has done for morale on some of our campuses that have done it. It's once again, just treating people the way that you would want to be treated. And I think that has worked well in our school district because we try not to operate where it's us in this building on the hill and glass, and we're insulated from everybody. We roll up our sleeves just like our teachers. I will go take over a class. I go and sub in schools. As a principal, I have driven kids to school for several weeks this year. I do what I have to do to let our teachers know that we're in the trenches with you, and we're no better than our custodians. If I got to go clean up a school, I do that. I've done it. People are like, well, you the superintendent, why are you doing that? It's my school district too. This trash shouldn't be out here like this. So that's how I feel that we've done it, and just taking care of them, not only financially, but even with some of the different unique things that we've all brainstormed on to try to help ease that stress and anxiety.
Yeah, I'll jump in on this one. The biggest strength of Children's Mercy are the 8,500 employees that we have in our organization. And there is nothing more important that we can do than to demonstrate to them that we care about their well-being and their wellness, so that their distractions that could inhibit them from providing the best care to the children we serve are minimized, if not just completely erased. So we have done a lot, and it started at the very beginning of the pandemic. We had a crucial conversation as an executive team about working from home or coming into the office. And I said, social distancing should not mean leadership isolation. If we expect our nurses and physicians and caregivers to come and take care of patients, they want to make sure that they know that their leaders care about them, and we're accessible, we're visible, and we're approachable, and we're ensuring that they are well. And to this day, we've done something like created a chief well-being officer, somebody whose job is to ensure that every day we're thinking about new ways of supporting the well-being of our workforce. Yes, it's about pay, it's about benefits, it's about the remote work program that we now have. We have 2,000 people working from home, but it's much more than that. It's about creating a culture where all of our caregivers and those that support that care know that they are engaged, we care about their well-being, and they are the folks that we rely upon to help us be a preeminent children's health system in the country. That's our most important strength. It's all about our people. We have a mindset that we talk about in our organization, which is mission forward and people focused. Our strategies, everything I talked about on the mental health side, it's an empty vessel unless we have incredible people who know that we care and are engaged in this journey, and that's what we're committed to as an organization.
You know, there are a lot of ways to take this. We've also increased salaries for every city employee, police officer, et cetera, which I think is important. But, you know, I agree with both what Mark and Paul said, to the extent that it isn't just pay, it's respect. And to tell you it's not one of the bigger mistakes I made, but a mistake I made as mayor. When I was not mayor in 2015, the Royals won a World Series, great celebration through downtown. The parade route turned towards City Hall and went by City Hall. And part of that was to tell our city employees who are proud to have Kansas City on their uniforms and any number of things, we love you and we respect you, and a win for this city and this region is a win for every one of you who do the real work here each and every day. For the Chiefs Parade, when I was mayor, we did not go by City Hall. And I had a few employees before the event who said, hey, is it going to make the turn by City Hall because we're important and special? We said, no, for whatever reason, we're not. Small thing, right? Not money for someone's vacation, not overtime pay, not anything, but something that showed them that you, me, and the entire region respects the work that they do. And so for us, I will say to the question, there's still a lot more work to do for us. I think we're also at a 4% level on pay raises for everyone, higher for many others. That goes a long way. But making sure that we stop and show them appreciation. For me, they won't let me do some of the things at City Hall sometimes or elsewhere, but I do think it's important that you visit with people, you interact with them, and one joy of the world opening up is that I get to go to more of those departments. I get to go to more places. I get to go to Public Works and talk to people about their real value, and hopefully we get another World Series parade or a Super Bowl parade sometime and we turn back by City Hall.
Well, I want to thank our panelists. I want to thank you for joining us here and for those joining us at home. And please look forward to a very robust public programming schedule in the weeks and months to come. Thank you so much.